To order. Chrissy, if you please call the roll.
Calling the roll, Mr. Jones.
Here.
Ms. Conwell.
Here.
Ms. Brown.
Here.
Mr. Schron. Mr. Schron is absent. Mr. Miller.
Here.
We have a quorum.
Can we have a motion for approval of our July 22nd meeting? Moved and seconded. All in favor say aye. Aye. Our minutes are approved. There are no items referred to committee today, but we have a presentation today on Care Alliance. Care Alliance is a health center that is in the central community, Ward 5, political boundaries, and of course my county district. But it's certainly a heavily impoverished area community with tremendous needs. And to have an organization like Care Alliance come in with a brand new facility, servicing our community and meeting the health needs of the residents of this county, they are a critical part of what's going on in I think the revitalization of our community in this area. So they have been invited to again share with this committee and the administration what is going on in their organization. So I'd just like to invite Care Alliance up to in their own way to present to us.
Good afternoon, Honorable Council, women and men. Mr. Cruz, thank you very much for inviting us this afternoon to come in front of you, the committee, to speak with you about Care Alliance. What do we do? Who do we serve? And more importantly, why we spend $15 million to open a 30,000 square foot facility at Central Neighborhood. And we have only about 10, 11 slides to walk through, but during that I will freshen it up a little bit so that you understand our organization. So, let's see. These advances.
Or the arrows.
All right, cool. All right, let's start with our mission. What's our mission? Our mission simply is to provide comprehensive medical services to those experiencing homelessness and those living in public housing or near public housing. So we've been in business since 1985. Started very small in a church basement as a pilot to address the need of those experiencing homelessness then. And from 1985 to 2015, we have evolved into an organization that now have about 110 employees, 11 million budget, and then been serving almost 10,000 patients every year, which is soon to be about to double as well. Let's go through our history simply. So 1985, that's when the pilot came about. 1993, we became an independent nonprofit organization because initially we were part of federation entity. So we became our own independent. 1998, we moved into public housing, primary care. And the reason being that as a continuum, if you're helping those who are not sheltered or do not have housing, and then after they've been provided medical services, moved into housing, then we need to continue the services that we were providing to them when they did not have a housing. So we leveraged the opportunity when it came up to provide services in the public housing. As it stands right now, we are located inside two public housing facilities. One is on West 25th, directly across from Lutheran Medical Hospital. It's called Riverview Estate, owned by Metropolitan Housing Authority. We're on the second floor, have 4 dental operatories, 5 medical exams from behavioral health, and providing services to the residents of the Riverview Estate. And then on the east side, we're also located at Cowview Stokes, which is also on the second floor, providing services to those. And then our latest project, which we will talk about that, is at the Central, where CMHA is revitalizing the whole community. And in 2000, we added what we call Round White Part C. And Round White Part C is primarily to provide services to those affected and impacted by the HIV/AIDS disease. So we have a huge program, and right now we have about 140, 150 in this program, providing services, medication to those impacted with the disease. So in 2007, we were lucky, we were among 10 organizations in the nation competing with Yale Health System, Chicago Department of Health, and others that received $1.6 million, $400,000 a year to provide HIV testing services in the county jails. And among the 10, we were really number 2 after the program was over, to the point that the federal government extended additional 1 year for us and gave us $300,000 to wrap up and replicate what we've done to others in the nation. 2011, we implemented the electronic medical record, which is a key, because serving this type of population, the transient nature, those living in public housing, we wanted to maintain that if a resident or one experiencing homelessness moved from Care Alliance to Metro to the clinic, their records will follow them because they're not going to take the paper records with them. So we spent about $325,000 to adopt and implement electronic medical record. And we did similarly for dental side. So we're one of the few not-for-profit organizations in the city, in the county, in the state that have both electronic medical record and electronic dental record. And then we achieved what we call patient-centered medical home, which is a nice concept where patients have a team of professionals that provide services to them. You have a doctor, you have a nurse, you have a case manager, medical assistant, and a care coordinator at some point. So when you come in, we make sure that all your lab, whatever you need, is ready. So you have time with the doctor. So you know your team, and then that's where the team provides services to. We did a behavioral health integration. The population that we serve, most of them, about 30%, do have psychosocial issues. So we realized from the onset that we need to do something about behavioral health. So we started exploring how could we effectively work with the behavioral health entities in the city or in the county. And luckily enough, we received $1.5 million in partnership with then Mental Health Services, Inc., for a project of 3 years, $500,000 a year. And United Way gave us money, $331,000. And as of last year or so, the federal government gave us $250,000 a year for 2 years. And we put them all together and work with Frontline Service that has the expertise, the protocol to assess the professionals in the behavioral health world. So I stand in front of you to share with you that right now we have almost 8 full-time workers who are licensed independent social workers, plus psychiatrists and other mental health professionals that are located in Care Alliance and complementing the primary care services that we provide. So behavioral health, primary care, including dental, is what we do. And in 2015, April 1st of 2015, fortunately, we were able to open our latest site, which is located on Central Avenue and East 30th. And this is very interesting because 2.5 years ago, the federal government released 2 RFPs for 1,200 community health centers, which are organizations like our site. And $500,000 was to renovate an existing site. And then $5 million was to build, a new facility. So $5 million for construction of a new site, have $500,000 to renovate. So these 2 grants, the $5 million was the interesting part of it because it was targeted for shovel-ready organizations because the federal government gave a very limited time frame to apply for the grant, the $5 million. So you got to be shovel-ready, you got to have a plan, you have to have a scheme, you have to have a land and all that. By the nature of Care Alliance Board of Directors and leadership, we were planning all along that if such an opportunity comes, we will apply for it. And we did apply for both. And I'm happy to share with you that we're the only organization in the state of Ohio that received both grants to the tune of $5.5 million. So that was the beginning of the new site. And getting the $5 million from the government, it was great, but it's not enough to build the facility. So we have to embark upon a combined campaign. You will hear as we move down the slide. So this is our current locations. I've already explained to you. We also added a mobile clinic. So currently, we have, just about a few years ago, we only have 2.5 sites. Primarily, now we have 6. We have 4 permanent sites. We have a mobile clinic that goes from permanent supportive housing, where those who are transitioning from homelessness have a place of their own that they could call home. So this mobile clinic is staffed by a mental health person, primary care person, and they go to this site. They rotate among 7, soon to be 8, permanent supportive housing sites. And then we have another site with Centers for Families and Children, because we started working with Sharon before Sharon transitioned into a new role. So we have a site over there. So we have really 6 permanent sites right now, plus 10 other sites that we do not own, but we send a physician and a medical assistant or a nurse, like Bishop Cosgrove, City Mission, Westside Catholic, St. Malachi, and other places like that. So 10 sites we do not own, but we own 6 sites of our own. Services I already explained to you. We do medical care, we do dental care. Dental, we do everything from a simple cleaning to even oral surgery right now. So we do everything for the population that we serve. And it's worth noting that we're the only organization that have 22 dental exam rooms. Organization of our size to have 22 dental operatories, that is commendable, because those are the sites where for-profit dental, like Dental Works and Ocean Dental, those are the number of exams rooms they have. But we strongly believe and passionately believe that our patients deserve better. So mental health, oral health is what we strive for, in addition to what we've already done. We've known to do primary care. We have behavioral health, we have supportive services. Our patients, in 2014, we served 10,000 patients. That generated about 35,000 visits. Patient demographics, sadly, 45% completely uninsured, and this number has changed. 8 years ago, when I started with this organization, we had 5% of our population that were insured. Most of the population that we serve have no money, no insurance, sleeping under the bridges, abandoned buildings, on the street, and they have nothing. So from 2007 to 2015, we have slowly and systematically increased the insured rate. And this took off when Governor Kasich passed the Medicaid expansion in the county. But we did a pilot with Metro Health called Metro Care Plus to enroll people who qualify for Medicaid in anticipation of the Medicaid expansion. So that taught us a lot how to engage this patient population. So 5% in 2007 to now, which our going rate is roughly about 55-60% insured. That's really interesting at this point. Over half of the patients have chronic illness, and the chronic illness, we're talking about diabetes, hypertension, asthma, COPD, serious chronic illnesses. Those are the patients that we deal with. 93% out of below 100% federal poverty. You know the statistics in the central neighborhood. It's not worth repeating over here, but here we are in a community where 40% of the residents are 18 or below. Even sometimes it's 17 and below. And sadly, some of these residents, these children, these youth are also having children, but yet there's limited pediatric services in this community. So that's why we moved to Central, to add on to what is already there by bringing pediatrics, prenatal, OBGYN, adult care, dental, and then behavioral health services. But the healthcare is changing for the whole country because of the Affordable Care Act. Now the competition is stiffer, and with us in a community that deserves the best and with limited resources, that's another thing that we come in front of you, and you see in my next slide why we desperately need any help that you could. These are unique healthcare needs, lack of income, lack of health insurance. These are not new. Transportation is an issue, but they delay, usually residents delay the care until they're really, really sick, and we have to make an intervention of that. Our operating revenue, I already shared with you, now we have about 11 million budget. Our expenses are cut to the minimum. Most of them are personnel, administrative overhead, administrative fees is hovering around 8%. So most of the money that we get goes to program, providing services for the residents and the population. We do have extensive collaboration because we realize we cannot do this alone. So we partner with CASE, we partner with all the behavioral health organizations in town, the schools. We let students from Tri-C, CASE, Western, do residency program, nursing program. They come to our sites to learn how to do community or urban health. And then when they graduate, we hope that they could come and work for us. Capital project, I tell you about the 5 million piece, and that's what I brought about Central. Why do we expand? There was a need. There was a before raising the 10,000 patients served. Now at full capacity, it will be 23,000 patients that we will be serving. And just imagine, in 1985, half a day a week in some church basement. Now you'll be serving 23,000 unique patients. So that would take us to roughly about 47,000, 50,000 visits per year. That's huge. That's a significant growth, very explosive growth. 8 dental chairs before, now we have 22 dental chairs. I can imagine about a year ago when we have only 7 dentists. Now we have about 14, 15, plus the related staff, they're going to about 20. Within the past 6 months, we have brought on board 50 new employees. You're talking about workforce development. We have added 50 new employees with the hope that by the end of the year, we will double up to about 130, 140 employee organization, which just a few, not even a few years, about a year or two ago, we were hovering around 60 employee organization. Oh, sorry, we'll go back for a minute. What are the challenges that we would like to share with you? Uncertainty about Medicaid expansion. Thank God, at least in the biennial budget, Medicaid expansion is still going on. Biggest challenge is the recruitment and retention. Every entity, whether it be Cleveland Clinic, University Hospital, Metro, St. Vincent, everyone is looking for these same qualified people. So in this city, it's so hard to get the cream of the crop to come work for us. And more so, it's not just working, people who exude a passion about the population they serve. Because before people will come to us, until they're really, really sick or they have a toothache that is bothering them, their main goal is wondering where they're going to sleep at night, particularly the homeless section of our population, where they're going to sleep. So when they come to us, they're sick or they need our help. So the people that we recruit have to be passionate about this population, not just work. And it's a little bit challenging to get that combination of I will help the less fortunate among us, and yet I'll still be compensated for my role. So growth in new environment, this first time we've been in Central, but we've provided services to residents of public housing. So it's not new to us, but it's new in the environment, new in the community. So we've had 2 full-time staff. In addition to my leadership, always at Central, knocking doors, increasing awareness, and competition for our patients before nobody cares about these patient populations. They have no insurance, they have no money, nothing. Now they have a card. They could go from health system A to B to C, or from Care Alliance to Metro to another community health center. So the competition is stiffer now than ever. And funding continues to be a challenge. And we are here today in front of you to ask the county, in your wisdom and your leadership, any assistance, any resources that the county will be able to help Care Alliance. You will be forever grateful for that. And that concludes my presentation.
Thank you very much. Are there any questions from the committee? Councilwoman? All right. Councilwoman?
All right, through the chair to director. How does Care Alliance work with other health institutions in the county
Okay.
right now?
Yeah, right now, we are breaking them down to behavioral health. We're breaking them down to the schools, and then, so let me talk about the behavioral health entities first. Before we formed partnership with these entities, we evaluated them. So we've selected about 4 key ones: Centers for Families and Children, Frontline, Service, Recovery Resources, and Beachbrook. Each one of them have a niche and have a purpose. If you take Frontline Service, they've been providing services to the homeless population. So the homeless population, they give the mental health, but they don't provide primary care. So the population that were receiving care under them were not getting the primary care. So you have diabetes and you go see a psychiatrist. Of course, you've seen a doctor, but that psychiatrist is not a primary care physician. So that's why we work with them. Our mobile clinic go to some of their site. We located in their main building on Superior and 17. If you take Beachbrook and Care Alliance is located on the same floor at Carbisto, so it's one door policy. They come to us for primary care, and our staff or our patients receive behavioral health from there. Universities, the same thing. Case Western send residents to us to learn urban health, and the residents complement our providers to see more patients. So that's how we help with the entities in the county.
Because in my mindset, all the health institutions that we have here are fighting for the same clientele, so to speak.
That is correct. And it's been a recent phenomenon because of the Medicaid expansion, but we already have a niche. We know how to treat, how to engage this patient population, because we are not reaching out to all the commercially paid patients. We're still concentrating on those experiencing homelessness and those living in public housing. And that has been our niche since 1985, since 1993. So yes, there's competition for the same patient, but because of the relationship and then rapport, the cultural sensitivity of how to deal with this type of patients, we know it, and that's why, that's how we are ahead of the competition in terms of that.
Out of the 110 employees that you mentioned, are all of them paid full-time?
The 110 are all salary, yes.
Okay. And do you have additional, I know when I used to work for the agency, when it was under another name, there were some doctors and dentists and things of that nature that gave back their time. Do you
Yes.
still have that?
Yeah, we still have that opportunity. The challenge now is that the federal government provide more practice insurance for us for free, but you have to be a full-time employee. So if you're a volunteer, so a physician at a later part of his or her career decides to volunteer for us, we will have to buy more practice insurance for the person. We cannot get a free more practice from the federal government. So when the person comes in, it depends upon the time, the number of days or number of hours that the person would like to work for us, so that we could see if it's worth spending money to buy the tail coverage to cover the person, because you never know in case of adverse outcome that they might go after the person, so we have to protect the person. So we have that opportunity, but we weigh our options.
On your mobile unit slide, is this set up like a mobile crisis unit?
I know Frontline Service have mobile crisis, but I'm not sure how their unit is set up. But our unit it's a 24 feet mobile clinic. It has exam room, it has a space for lab, and it has where the nurse practitioner, the nurse and the mental health professional will sit and do the paperwork, and then also speak with the client. So that's how our setup is: exam room, a place to use to draw the lab and things like that.
So it really doesn't assist with if there's a client at that need that's in a crisis situation? I'm sure if you do see it, you would probably contact Frontline, but you don't deal with it directly.
And that's the beauty of it, because in that mobile clinic, we do have a frontline staff, high-level behavioral health professional in that mobile health van as well. So we have a nurse practitioner from primary care and a mental health professional, plus the medical assistant. So they all work as a team. So in terms of a crisis situation, this frontline person will refer or connect back to the permanent site to provide the right intervention.
Do you assist, and you may have stated this, do you assist with insurance sign-up?
Yes, we currently have 8 full-time that help people to sign up on the Medicaid expansion. And that's why you could see our insured population going up. Because prior to Medicaid expansion and the pilot that we did with Metro, we learned a lot. There was a lot of lessons learned how to engage our population. So we hired 8 full-timers that they go to hard-to-reach places, they're located in our site, and enroll these patients into not just Medicaid, Medicare, SSI, and all those insurance programs that the country has.
And I have a couple questions, but
Sure.
I'll just do one more, and then I'll let some of my colleagues. In dealing with the chronic illnesses in the homeless population, what is your mission, or how do you plan on increasing their participation in regular health care?
That's a very challenging portion, but we have come to realize or find a way to deal with that. With those experiencing homelessness, we know where they congregate. They go to Bishop Cosgrove for lunch, they go to City Mission for dinner, they go to some places for breakfast. So at that time, we sent a nurse and a medical assistant to go to those places. So during the outreach time, we provide the best care that we could, and then make a referral for them to the permanent site. But we also have 3 vans that could transport them if it's an immediate need, and make an appointment for them right away so they could come and see a doctor or see a dentist or see a professional at the permanent site. And they are all close to the shelters or places where those experiencing homelessness congregate. But in terms of the public housing, we are right there. In Riverview Estate, we're on the 2nd floor. Calby Stokes, we are on the 2nd floor. And our latest site, which is Central, once Jeff Patterson and his leadership build those homes, it will be all around us. So literally, we'll be in the middle of all this new market-based home will be built. So, yeah.
The education, some education, I guess, regarding the correlation of for the homeless population, because I know it's probably a little better for the individuals that stay in public housing because it's right there. More education, I guess, regarding the correlation of health in relation to having an apartment and keeping a job, how your health is correlated with that. I guess would be my suggestion.
Yeah, well, how we do that through what we call our care coordinators. So the care coordinators are part of the team, and the team is made up of as a doctor, a nurse, but not only that, we backed it out with certified diabetic educator. So for those experiencing diabetes, if there's an asthmatic patient, the team knows about that. But the referral is usually made by the care coordinator. So we finished a diabetic patient, we help with the insulin, we help with the metformin, but we realized that the A1C3 is through the roof. So the care coordinator to make sure you go to Metro or you go to clinic to see someone, a specialist over there, in order to avoid amputation of the limb or so. So, and all these things we do for the patient.
Thank you.
Councilman Miller?
Mr. Chair, thank you. Thank you very much for coming and joining us, and I'd like to congratulate you on the opening of the Central Clinic and also on the development of the integrated physical and behavioral health program, which are very significant advances. Am I correct that Care Alliance is a federally qualified health center?
Yes, Councilman Miller, it is. And I'm sorry for not stating that earlier. We're one of the 5 federally qualified health centers in the city of Cleveland.
And You anticipated who are the other four?
The other four, one is called Neighborhood Family Practice. It's located on the west side. And then Free Clinic recently became a federally qualified health center located on Euclid. And so that's the three. And the fourth one and the largest one is Neon, which is located on the east side.
It is what?
Neon, Neon.
Neon.
That's the name of it.
Okay.
Yeah, I forget the what is I think Northeast. They changed their name years ago, but I'll call it Neon. Do you know what Neon stands for?
Ohio Neighborhood Services.
Northeast Ohio Neighborhood Services. They're located on the east side, usually around half area and 82nd. And then the latest one is called Asia Inc., which is caring for the ethnic group located on 36 and Superior.
Okay, thank you. You said that 45% of the people coming in now are totally uninsured.
Yes.
My question is, of that group, how many of them would qualify for Medicaid if they applied?
That's a very interesting question. And I'm saying that is that of the 45, I can't say a percentage that will qualify, but I do know some will qualify for Medicaid. But just because they qualify for Medicaid, they might have some reservation, whether through some legal system or whether through some social system, that they don't want to be bothered with the paperwork. Even though they will not do the paperwork, we will do for them. They don't want their information to be shared with the big brother, so they refuse to be enrolled in the program.
If they're willing, do you help them?
Oh, yes, if they will, and that's what the main function of the 8 full-time care coordinators that we have. That's their main function. Help them go through the system with them, sit down with them, and then help them enroll into these programs. Yes, we do.
So you do quite a bit of that.
Oh, when I say that in 07 we have 5% insured and now we have about 55-60% insured, it's through the help and the investment that we've invested in this type of program to help this population to be enrolled on these programs.
My final question is whether you use a medical home model in the sense that do people come in and get a particular physician or nurse practitioner or some other professional assigned to them that they work with on an ongoing basis around their preventive and ongoing health care, or is it more episodic that when people come in, they come in for a specific problem and they're treated, but they don't maintain an ongoing relationship?
Now, Councilman Miller is the first one that you said. That's what we call patient-centered medical home. So when a patient comes in, patient is assigned to a team with the hope that every time the patient comes, we'll see the same team. And the team is made up of a doctor, a nurse, a case manager, medical assistant. So this is the team, and they will work with this patient every time. We'll pre-call the patient, hey, your appointment is coming up. Did you go to Metro to see the specialist that we recommended? So that's what is the first part. And we, in the nation, the PCM, Patient-Centered Medical Home, is usually accredited by a body called NCQA. And you don't need all this acronym in healthcare. But what I would like to share with you is that the big healthcare system, Cleveland Clinic, Metro, UH, and others, they attain PCMH level 3. Level 3 is the highest that you could get, and Care Alliance has PCMH level 3. So the services that we provide, we don't cut corners. And when we decided to go for electronic medical record, we went all the way up. When we decided to go for electronic dental record, we always say that we could play with the big sisters and big brothers, but we have to cut our code according to our size. So if you realize that That team approach that Councilman Miller, you said is the right approach. That's what we strive for. And then we have the team to address the patient from that angle.
Okay. Thank you.
You're welcome.
Councilwoman Brown?
Thank you, Mr. Chair. You touched on the outreach. I was just curious, are the appointments, are the patients allowed to do walk-ins, or is it strictly by appointment? How does that work?
No, it's a combination of walk-in and scheduled appointment. But we encourage walk-ins more because of the patient population that we serve. So you give somebody an appointment to come and see a doctor in 2 weeks. More likely than not, even if you pre-call the patient 2 days ahead, they have a whole array of issues they're dealing with. So if they could come in any time, that's what we advertise for. So we have both scheduled and walk-in, but we encourage more of walk-ins.
Excellent. And then with regards to the services that you provide, there were 4. Do you have a breakdown perhaps of what percentage of services are utilized? So is 25% medical, or do you see higher services in dental?
That's correct. Most services are from the medical side. Most services, because medical is the largest piece of our operations. And it started because of our funding source drive for medical services. But the greatest need is dental. That's the greatest need, because it doesn't even matter how much money we get and bring on dentists and hygienists, and we can't even move the needle because the demand for dental services is so great. And then when you think about, we basically do not charge anything for those 100% at or below the federal poverty. When somebody comes to us for dentures, taking the specification alone, taking the pictures and sending to lab, it costs us $250. Forget about the dentist time, forget about the dentist salary, forget about facility fees. That's $250 just for outside lab to process that. We underwrite all of those. So if I need dental care and I qualify to be your patient, definitely I'm coming to you. I'm not going to pay $400, $600 to Ocean Dental for dentures. I'll come to you. So the demand is great, but the largest portion of our operation is really from the medical side.
And my last question, with that being said, how are the prescriptions processed? Because you spoke on chronic illnesses and the homeless population. I'm guessing they're going to have some challenges with maintaining medication. So can you speak to that?
Yes, that's a very good question, Councilwoman Miller. First, we're the only organization that pays for medication for our patients. So none of the community health centers that I mentioned, if you go to them and they give you a script, you'll be on your own, whether you go to CVS or Walgreens. But you come to Care Alliance and one of the physicians or mid-level practitioners or dentists or hygienists give you a script. First of all, we don't give paper scripts anymore. We send it electronically to a pharmacy of your choice. That's number one. So we pay for that. We pay for the cost of medication. We pay for dispensing fee. I mean, we decided about a year ago to charge about $2 a fee so that people feel they have ownership in their health. And if the script go over there and the patient says, I don't have transportation, we utilize our 3 vans either to transport them or to make sure that we get the medication because they have to sign for it. We transport them to get the medication, or we work with a pharmacy to get the medication that they need. We've been fortunate because prior to building this new facility, most of our patients used to go to Dave's Pharmacy or Dave's Supermarket located on 30th, 32nd and Payne. And we are located on 15th and St. Clair, where all the shelters, women's shelter, men's shelter, Bishop Cosgrove, and all of them are located. But with this new addition at Central, we are going to have our own pharmacy. And we're working with the pharmacy board that once that is done, can we package some of the medications? Could we have the authority to package the medication in our site? So when somebody living in Riverview Estate or Westside doesn't have to travel all the way. So we're working on that, but we will have our own pharmacy for the first time to be open in November. no later than December.
Excellent. Thank you, Mr. Chair.
Thank you.
You mentioned some of the barriers to care are distrust of the system. When you mentioned the 45% of uninsured, it was intriguing in that you mentioned how some, I guess my question really is, you have really been meeting the needs of individuals who don't connect to the system. It's always in dealing with the poor a unique challenge, and it sounds like you have worked a system to actually meet the needs. When I think of things like Safe Surrender that we have, the county has done unique programs to encourage the community to sometimes deal with criminal issues. Is that some of the factors in that uninsured? That sometimes criminal background, sometimes the challenges as to why they might not want to be plugged into the system. Is that?
That is absolutely correct. And because it has been our niche, it's something that we've done. Even when Councilwoman Conwell was with that organization, we have learned the nuances how to engage this population. But there definitely some, because of their background legally, or because of mental health issues, or even child support, because we've learned a lot that getting more of their information exposed their background about delinquency. So they won't be bothered to go through the paperwork to do that. So they will stay when they're really sick and they come to you, because when they have no insurance, you are still seeing them. So now that they could qualify for insurance for you to bill, that is not their priority. That's our priority. So we could bill Medicaid, hire more doctors, hire more nurses to help them. But whether they have money, they don't have no money, they have insurance, they don't have any insurance, and they come to us, they're still gonna get care. So why should they expose what is their hindrance from their life to enrolling on the Medicaid? So that you're absolutely correct.
Some of the challenges that you have as an organization, you mentioned the uncertainty of Medicaid expansion. Speak a little bit more to that, just for that particular challenge that you have.
Yes. Even though we, as a state, we are very lucky, but when the governor was going through the biennial budget, there was a serious reservation, or we're on our knees that the way Medicaid expansion was passed, initially, December 9th of 2012 or 2013? 2013. The way it was done, with the biennial budget, it will be excluded. And if that was going to be excluded, a significant number of poor people, population that we serve in jeopardy. But knock on the wood, it was maintained in the biennial budget. But even still, the ongoing part of it, we have to, because if 60% of the population that you serve have Medicaid, and all of a sudden Medicaid is pulled from their feet, the only choice is to depend upon the federal dollars or to seek foundation assistance to help them. So that Medicaid piece, the expansion is great, especially Care Alliance. If it wasn't it, our insured population would not get to this point where we could receive some income to sustain our operations. So we're watching it very closely, but now we have a reprieve because the biennial budget was passed. So we know it's continuing for at least the next 2 years.
So you've been serving really the most vulnerable people within this community, and the bulk of your organization, if not all of it, is within the city of Cleveland?
Yeah, most of our sites, most of our clients are within the city of Cleveland.
Have you had any partnership or funding with the city of Cleveland themselves? Are they?
Yes, we've had. We're part of the Healthy Cleveland, the city department initiative. We're part of mental health issue that Director Pennell, Director of City of Department of Cleveland, is doing right now. We are at a table guiding them with our experience and lessons learned. So, and are there any partnership with the city that you could?
Well, they gave us money for the building.
Right, that's the funding aspect. So beside programmatic side that we work with them, at the beginning of the fundraising, the city was able to give us $180,000 towards the construction of Central. And we were very grateful because it was at the beginning. before even the foundations step in and help us realize our goal. So yes, but we do partner with them from Healthy Cleveland standpoint and other initiatives.
Great. Well, as I said, I had the opportunity to tour the organization, and I saw the consultants at work. I saw the many dental facilities that you have, a beautiful facility right there in the community, and you're doing excellent work. And I'm really glad you were able to come out today. Are there any further questions from the committee? Councilwoman.
Through the chair to Director, what training do you provide your employees to deal with the homeless population?
That's that's a very good point. When depending if you a medical assistant or you a nurse or you a care coordinator or you're an outreach worker, it depends on the type of training you received. However, every new employee is provided during new employee orientation, and depending upon which area you work, if it's really outreach, then we work with frontline service to do trauma-induced care, how to deal with this type of population, or we send them to specific seminars or conferences that are usually given by the state association, or we have a national association called National Council for Homelessness, which is really located in Nashville, but it has almost about 250, 300 grantees. So from time to time, not only webinars, but they give conferences that, depending upon the area of one's work, we pay for them, we give them the time off or the day to attend those conferences so that they could be informed about how to deal with this population that we served.
And that was just kind of my thought when you had reached out earlier and stated that, what could the county do to help your organization? And so I was just thinking in the lines of possibly training. We do have ongoing training. I don't know if it's as specific as dealing with the homeless population, but we could reach out to Levine Ross to check into that, because I know there's all kind of de-escalation measures, things that you guys, with your staff,
Right.
would privy to having dealing with that population. My last thing would be, do you have a working relationship with our Director of Office on Homeless Services, Ruth Gillette?
Very, very close relationship. And right from the beginning, Ruth, well, first of all, we're part of Office of Homeless Services. So we are a member and we attend meetings. So meetings I cannot attend, one of my leaders will attend on behalf of Care Alliance, Dr. Nagel. So we're right there with them. They give us opportunity to present in front of them. But Ruth and I have become such a close friend that most times whatever is coming down the pike that impact the population we served, she will tell me or she will alert me so that we should be prepared, or how should we proceed with that. So we are in constant communication with Ruth Gillette, and even then it was Ruth and forget the gentleman's name who transitioned out in March. But yes, we work with Ruth very closely.
So I don't know if she has mentioned this to you. There were some individuals from the Homeless Congress that claim, many of them seek services at Care Alliance, your facility, that I guess when the doctors put them on bed rest or give them home care instructions for bed rest, that was kind of an issue that was transposing over to the homeless facilities, the shelters.
Yes.
So I don't know if she brought that up. It just would be, since I was
Yeah.
one of the representatives that the Homeless Congress brought that up to, just if you could work on that.
Yeah.
One will say, one thing, one will say the other, but
Now,
if you
Councilwoman,
guys are
that
working
is,
on
it is so true. No, you had it right. It wasn't Ruth. Brian Davies was there, and then Brian came to speak with me about that. So what actually happened is our community women's shelter located on Payne and 30th or 30 plus. Our nurse practitioner who goes over there on Wednesday, the women love her. She's such a nice mid-level practitioner, physician assistant. So what it is that she felt so pity for these women to be on the street. So when they requested a bed rest notice, she was writing them like candies. And I'm glad Brian came to me because he didn't even go to any, so she was writing them. So what was happening is that because they have that order from the clinician, you can't put them out. But the community women's shelter also have to clean where these women are, like make the bed and, do the cleaning to maintain sanitary health for them. So it was creating confusion. So then when this nurse practitioner started writing the bed rest order, they disregarded that. So Brian said that how could lay person disregard an order from a physician? Unknown to me, I'm like, what's going on? So I pulled my medical director. He did not know, but luckily we know the one who goes over there on Wednesday. And she was very transparent enough to admit that she was the one who was writing them. So her, myself, the medical director, we went to Community Women's Shelter, met with the leadership over there, explained to them what was going on. But from there, we learned our lesson to be, because you have to balance both the human side and then also their residency. So then we were able to resolve that amicably, but it was going on. The women were complaining because now somebody is sick, can't be on the street, and now you're gonna put her out, but yet the workers over there is saying, "God, we need some time, we need them to be out to clean." So there was a balance, but it's true. That whatever you're saying is absolutely true.
So that's
Yeah.
why training would
Yes.
be, because there's certain things when you're dealing with the homeless population that you don't know unless you're getting
Yes,
constant training. So I'm glad that worked itself out.
yes. We are learning that a lot. I could tell you my professional career, 8 years in Cleveland, prior to that in Miami, volunteered a lot at a homeless organization, the biggest one. I thought I knew it, but no, nothing like you're responsible for an organization helping this segment of population. So,
Any further questions from the committee? If not, Mr. Guining, we appreciate you coming out and your entire team. And if you have any final comments?
yeah, I just want to say thank you to councilwomen and councilmen, and definitely, okay.
They had a 2 o'clock
anyways,
appointment, they had to step out. Yeah.
But we really appreciate the opportunity to come in front of you. And please, any assistance, funding, resources that you could give us will go a long way to maintain the mission of the organization. So I want to leave that thought with you. It doesn't matter a penny, it doesn't matter $1 million, whatever within your heart and within your organizational resources that you could help us is what we're seeking at this point. So
when you say whether a penny or $1 million, what you're really saying is just the connection to the county, that partnership
yes,
means something to the community when you can go out.
absolutely.
Okay.
Absolutely. So we could put you on our donor board. County Commission gave us X.
All right. Thank you very much.
Thank you very much, Councilman Pennell. Okay.
Is there any other miscellaneous business from the committee? Chrissy, has anyone signed in for public comment?
No, Mr. Chair.
If not, well, if nothing else holds our attention, our meeting is now adjourned.